Welcome to the Obesity Medicine Podcast with your host, Dr. Matea Rentia, board certified in internal medicine and obesity medicine. Here, we talk about a path to metabolic health, and we have real conversations about chronic weight management and living a full life. Just a reminder, I am a physician, but I'm not your physician. So everything that's on this podcast is for informational purposes, but please go talk to your doctor about what's right for you. There is no medical advice being given on this podcast. Welcome back to the podcast, everybody. I'm really excited today to have on a really amazing dermatologist. Just to give background here, because I always explain why I bring someone on. In my world, I really work a lot with patients going through significant weight loss. Often they're on GLP-1 medications, and one of the most emotional side effects that they experience is hair loss. And I know that we have this saying, and that, well, I hear this a lot, that time is hair. One thing that I see is that people are not getting help soon enough. And by the time they're bringing it up to me in a visit or something's happening, they're pretty progressed with their hair loss. I'm bringing on Dr. Nolan today to help us understand what even is the hair life cycle? Maybe when should you get treatment? What are some options? Just really talk through this so that you can all be more educated where you're listening, and then you can get the right help that you potentially need. Dr. Katherine Nolan, she's a clinic owner of Carabella Dermatology in Carmel, Indiana, and she's here today to help us deep dive on hair loss. Can you start out by introducing yourself a little bit and letting us know how you like to help patients?
Sure. Well, thank you so much for having me here. Super excited to join you. I am Dr. Katherine Nolan. I'm a board certified dermatologist and I focus in hair loss. I have my own practice here in Carmel, Indiana, but I'm also licensed in most major states in the United States for telemedicine, and I do a lot of virtual hair loss consultations as well. And I have a special interest in hair loss. I had worked at University of Miami with Dr. Antonella Tosti, who's one of the big hair loss experts in the world. And I also have a personal interest in it. I had experienced really severe hair shedding after having my second daughter. So after that, I really connected with a lot of patients suffering from this and wanted to help as many people as I could.
Yeah, thank you for sharing that, not only your training, but also your experience. In your practice, what are the most common reasons you see for hair loss? So especially maybe in someone that is going through maybe a big weight change, because that's a lot of who's listening.
Yes, absolutely. Definitely, we see a lot of patients with severe shedding after any sort of real stress on the body. Like I mentioned, the postpartum time is a really common time we see people struggling with severe hair shedding, the type I went through. We also saw a lot with COVID. So it's interesting to see the journey I've seen with my practice with this. We would actually see often about 3 months after we would have these spikes of COVID, we would also see people with really severe shedding would all start to come into clinic. And then just when we were starting to get past the COVID hair loss, we're now seeing a lot of people who are doing amazing with the GLP-1 medications and so happy with the way they're looking and with their health overall after losing weight, but now they're struggling with losing hair, shedding hair. So we definitely keep us busy, all these different types of hair shedding we see with any sort of stressor on the body.
Can you going more into that? Because I know, so stress can really be anything from what you're describing. Can you walk us through? So what happens with the hair growth cycle during that time? So, because I think patients tend to think it's like a week or two, but I don't really think they understand how many months or what's happening with it.
Right. So it's really interesting. So a lot of people think of just stress traditionally, like, oh, I'm stressed out. And so people often associate that with hair loss and hair shedding. But really, when I'm talking about stress, I'm talking about more like physiologic stress on the body. So something like a major weight loss, like more than 2 pounds a week over several months, or like a fever, hospitalization, surgery, something like that. And it's also really hard because patients often may not even remember what the particular event was that could have triggered it. Because how the hair cycle works is there's three main phases. There's the growth phase of the hair cycle called anagen. And this is what most of our hairs are in like right now. So just the growth phase can last several years. And then there is a resting phase, which only part of our hairs are in called telogen, and then the hairs shed after that. And so whenever there's any sort of physiologic stress on the body, it can shift hairs from this normal anagen growth phase into this resting phase at the same time. And then the part that's a little confusing for a lot of my patients is it doesn't happen just right after the event. So say you had COVID, the hairs wouldn't fall out right after you recovered. It would actually be often about 3 months after that, because that's how long the hair cycle takes just to complete. And so then all the hairs then start to fall out at the same time, that 3 month window after the event.
Wow. Okay. So 3 months later, potentially, how long, let's say that the stressor's gone and now they're doing okay. How long, and we're going to assume, because we'll get more into this, we're assuming like no micronutrient deficiencies or anything else that's problematic going on. How long is it until they can expect to start to see some regrowth? And is it normal to get all the regrowth, or is there a certain percentage that doesn't come back? I know there's probably lots of variables.
Yeah, no, that's a great question. That's the question that so many people want to know the answer to. So I would say generally the timeline is there's this physiologic stress in the body, and then in about 3 months, we start to see the shedding. That often will last several months. So I would say usually in the window around 3 to 6 months, we see the shedding continue. And it's usually around towards the end of that when patients are coming in to see me, they are done with this, really hoping things are going to get better. And at that point, usually things start to recover. The shedding starts to slow down, and then we'll start to see little baby hairs, short regrowing hairs start to come in. So I would say the whole thing in total is usually about a 6 month period. But as you mentioned, if there is continuing stress on the body, so if, say, somebody has really low iron levels or they're anemic or some sort of thyroid issue that we haven't identified, then patients can enter into something called chronic telogen effluvium. So this is a chronic shedding phase. And a lot of people, especially a lot of women, are actually in this chronic telogen effluvium for years. And so that's why it's super important to work up the hair loss, to try to get an answer to what's going on so we can hopefully treat that to get the hair growing again.
Something I forgot to say in the beginning of the episode, and I think you said you're okay with me disclosing this, but I actually see you as a patient. And that was one of the things that we identified with me was this chronicness to what was going on with my hair. Because with me, when I started medical school, I'll never forget this. We were, I don't know, like maybe 3, 4 months in. It was before the winter break. I remember looking in the car window and it was like, oh my gosh, in the front, it was so much hair was gone. And I just thought, oh, well, whatever. And I didn't know to get help at the time. What were you saying with the hair being like a window into the body?
Yeah. So I think what's so interesting about hair loss is that it often is the first thing that we see outwardly that there's something going on the inside. So I have had patients who notice shedding or thinning. And then when we do a little bit more workup, we can often find out that maybe they have some sort of very low iron levels or they're having some sort of thyroid problem. I even had a patient who was getting some sort of arsenic poisoning who came in
Ooh.
to see me for hair shedding. And so it's really, I think, fascinating. It seems like the body, whenever there's like a stress on the body, it shunts resources away from the hair. It's like the hair isn't important. Let's keep you alive. Let's keep you protein elsewhere in the body. So I think, unfortunately, with weight loss, when it's intentional, the body doesn't really know the difference. It's, oh, maybe we're in a famine. Let's try to redistribute our resources to other things. I think it's really interesting because it can sometimes be also a good signal for somebody to maybe seek out medical care, to maybe get some blood work done. And it can identify, obviously, the hair is super important to a lot of women and to everybody in general, but it can also be a signal to kind of look for other things that may be going on in the body.
Definitely. And you said you've mentioned a few different kind of medical conditions and things. If we thought about labs for a second, and of course, everybody listening, this is not comprehensive, talk to your medical doctor, but are there just a few basics where you're like, we got to make sure thyroid, iron, what are the few labs that you feel no matter what type of hair loss that probably these labs should get checked?
Absolutely. I would say the big three ones we look at are ferritin. So this is markers of iron stores in the body. I would say that one's number one. We want levels to be over 50 for that. So what's interesting about the ferritin is the levels that we want for just making red blood cells and just for overall health is usually above 20, but we actually want the levels to be a little bit higher for ideal hair growth. Whenever the levels are a little bit low, like I was saying before, the body starts to shunt away from the hair. I would say also another lab that's super important is vitamin D levels. We ideally want the vitamin D levels to be around 50, I would say the 40 to 60 range. But again, it's not like low normal levels can be okay for overall health, but not great for hair health. The third one that we look for is usually like a TSH or thyroid level. So those are always the big three that I check for any patient with unexplained hair shedding, hair thinning. Some patients want to get a lot of additional labs done, like hormone labs, all this. And I think there definitely can be a role for other types of health conditions, but usually not super high yield for the hair. I would say usually just a simple 3 lab panel is enough for most types of hair loss.
Okay, awesome. If someone came in and we're assuming that their hair loss is because of rapid weight loss, they're on a GLP-1, something like that. Is there a time and a place to use medications to help with that? Or is that something where watch and wait, or you have tips for them during that time? What's your approach there?
Yeah, absolutely. So I would say initially, when somebody is having significant shedding of the hair or a condition called telogen effluvium, which is basically just a really fancy word for acute shedding of the hair, the conventional thinking is that we first just try to identify what's going on, remove whatever potential physiologic stressor we have going on, and that the hairs will recover. However, having personally experienced some of this is part of the reason I got very interested in this topic is it's very easy to tell patients, oh, don't worry, your hair is shedding, it will get better. And the wisdom is that this will recover. It is a temporary condition. However, it's very distressing when you are seeing hairs all over your car, all over your shower, all over your floors. I mean, you can lose 30, 40, 50% of your overall hair during this period of time. I definitely am an advocate for intervening a little bit earlier with patients with this type of shedding. We are now using a medication called minoxidil. This is the medicine that is in Rogaine. People use this over the counter, but we are also using low dose oral minoxidil. So this can help shift the hairs out of the resting phase back into anagen or the growth phase. This can help patients to stop the shed before it becomes too severe and then also help the hairs to grow back. Also, a lot of women, myself included, also have some female pattern thinning as well. So there's often more than one thing going on. And so a medication like the minoxidil can also work on that. That will help to just thicken the individual hairs because when somebody is getting severe shedding, it can sometimes now unmask a thinning that they already had. They may not have even noticed, but all of a sudden, now that we're losing some of the density of the hair as well, all of a sudden we start to notice that thinning a lot more.
Yeah. Oh, this is really good. One question I have is I feel like back in the day, folklore was always if you're using minoxidil, you can never stop it. Let's assume that the other patterns aren't involved and it's just from weight. Are they able to use minoxidil during their weight loss and then stop it a few months later? Or do they have to be on it for life?
Yeah, no, so that's a really good question. It comes up a lot. So I think there's a lot of just like you're saying, for folklore related to minoxidil. I think there's a lot of concern that if you stop the medication, then all of a sudden you'll wake up the next day and kind of all the hair that you had grown will come out. So none of that is really the case with minoxidil and specifically the oral minoxidil. It definitely will stimulate hair growth, help to thicken the hairs when you're on the medication. And then, like pretty much any other medication, once you come off, you will eventually, over several months, start to gradually go back to what your normal baseline would be off the medication. However, if the type of hair loss is due to some sort of more short term event, like recent weight loss, then once the weight loss is stabilized, and if there is no other issues going on that could contribute to hair thinning or hair loss, you should be able to get off the medication. I have had a number of patients like this where we have them on the oral minoxidil, maybe for just like a 6 months, sometimes like 1 year window, just to get that over kind of the hump with the acute hair shedding. And often patients do really great off of the medication and they can continue to regrow the hair. Really good question and something that people are always asking about a lot.
I have two questions. Number one, what's the efficacy difference if you know the difference between using like topical versus oral? And then once you start oral, how long do you have to be on it until you could expect to either see results or see some change? What are we looking for in the beginning, essentially?
Topical minoxidil has been around for a long time. I would say sometimes we're limited a little bit by absorption on the scalp, and this really varies a lot. I think we don't fully understand why some people respond a lot better than others to the topical minoxidil. I think some of it, honestly, is just even the hassle of doing it every single day. I have some patients who are very, very diligent and use it religiously once or twice a day. And they often do get a very good result. Maybe not quite as good as the oral minoxidil, but
Mhm.
they do get a pretty good response. But I would say the oral minoxidil overall seems to be more potent in most patients. The downside is sometimes then you grow hair not just on the scalp for a little bit, but most people are so happy with how great the hair is growing on the scalp that pretty minimal side effects otherwise. In terms of the timetable, so that is also a really good question because it is not instant, unfortunately. So, because of the nature of the hair cycle, just like how we mentioned, it takes about 3 months to see the hair shedding start after some sort of event that stresses the body. It also will take at least about 3 months to really see any change with starting a medication for hair loss. So, I would say it's usually at about that 3 month window that I'll be able to see in a patient. And usually I look up close at the scalp with something called dermoscopy. So, looking under specialized light, magnification. And so at that 3 month mark, I'll start to see little tiny baby hairs start to come in. However, as a patient, you may not start to notice it until maybe closer to the 6 month mark, because that's how long it takes just for the hairs to get long enough that they are a little bit more visible.
Interesting. Yeah, when you bring that up, it's like you have to have some commitment that you're willing to stick with this for a while, right?
Absolutely, absolutely. Yeah. So I do definitely have some patients who will try the oral minoxidil or something like that, maybe for like a couple weeks, a month, and then they're like, this isn't working and want to stop it. But it's really important to explain from the beginning that this is going to be more of a longer term treatment. And we have to be a little bit patient to see the ideal results that we want.
Are there other medications that would be used for hair loss? Because I feel like I hear a lot about like spironolactone or finasteride, other ones. Are there other medications that are commonly used for hair loss with that?
Yeah, so I use a couple other medications pretty commonly. So the other big class of medications we use for hair loss is the DHT blockers. So these are ones that are more treating female pattern or male pattern hair loss. So those are driven by androgen, kind of testosterone type hormones in the body. And so these medications, the most common ones are finasteride or Propecia, and then also dutasteride that we use off label. So these help to basically push pause on the progression of these types of female pattern, male pattern thinning. And so a little bit different from the type of hair loss we see with the weight loss medications, telogen effluvium or acute shedding. However, I would say a lot of people have an overlap going on. And so if I do see that in a patient, we will often add one of these medications as well. And so it works like a different mechanism. They usually have very minimal side effects. People do really well with them. And that can really help to thicken the hairs as well if there is a component hormonally as well.
Amazing. And is spironolactone ever used?
Yeah, so spironolactone is also a DHT blocker. It has some anti-androgen properties. It's funny, a lot of these are all originally blood pressure medications, and so they are all used off-label a little bit. Basically, they were given for high blood pressure, and then we started to see all these properties like people growing their hair back. But in terms of spironolactone, I use it a lot for like acne and other indications. I use it sometimes for hair loss. It's used often in women who are a little bit younger. And so we will often use it in women who are not postmenopausal just because it's a little bit safer medication. The finasteride, dutasteride, a little bit stronger effects on the hair and the DHT, but they aren't great sometimes for women who are wanting to get pregnant or have kids, just because it can cause sometimes some issues with like birth defects if they were to get pregnant. So sometimes people use spironolactone as a little bit of a like safer option for somebody who is wanting to have kids in the near future.
I'm glad that you brought that up because I don't think if people are not medically trained that they realize how significant when we have young women, it's totally different medication that we're using for them, just like across the board, like blood pressure medicines, everything. We always need to think about a potential pregnancy. And that's just interesting because I feel like sometimes I'm only hearing people say spironolactone. And in my mind, I'm like, wait, why are we only talking about that? And now I'm realizing it's the younger patients that are telling me that. So, so this makes sense now.
Yeah.
Yeah.
Yeah, it's interesting. Yeah, and I feel like the spironolactone, it definitely can help a little bit, but it's not quite as strong. I haven't seen as good results with that as with some of the other medications. And I feel like it's a really interesting topic. I feel like there needs to be definitely a lot more research into young women and treatments for them and what could be safe during pregnancy, breastfeeding, because that's a whole category and nobody really wants to study. I guess that's a kind of a high risk area, but we definitely need even more treatments for young women with hair loss.
Are there any common myths or misconceptions about hair loss where you just see it online and you're just like, gosh, I just wish that patients would understand this?
Yes, absolutely. And I think having experienced this myself, I can definitely relate to some of them. So, a big one that comes up a lot is when patients are having really severe shedding, they become extremely afraid to even wash their hair, brush their hair, style their hair. And I can definitely relate to it. It's really scary, like when you take a shower and you're seeing clumps of hair come out. And so, I have a lot of patients who will just completely avoid shampooing their hair or showering for sometimes even like a week or two, just because that's when they're seeing the hairs coming out. And so, what I do try to explain to these patients is that these hairs that you're seeing coming out, unfortunately, they're going to come out regardless of what you do. They're already in this shedding phase. And so, any sort of touching the hair, washing the hair, they're going to come out regardless of what we do. So, not to be afraid to continue to wash the hair as you normally would every couple days, not to be afraid brushing the hair, normal styling of the hair. I do usually tell patients to be a little bit more cautious with any sort of tight hairstyles or things that would maybe put a little additional stress on the hair, like intense heat styling and things like that. But generally, there's not much you can do to the hair that's going to worsen this type of hair loss. It's more internal what's going on. Another really common one that comes up is patients will bring in just bags of like they've spent a fortune on just so many over the counter serum. There's such a market out there. I mean, I think it's like $1 billion plus market for all these over the counter kind of hair loss products. And obviously, I can't speak to everything, but I would say the vast majority of things are not going to really get to the root cause of what's causing this acute shedding or even female pattern thinning. So I would say try to, if you're going to conserve your energy and money, I would try to focus on the things that are more high yield, like trying to get a dermatologist to take a look at what's going on and come up with a good plan to get the hair thickened up and help with the shedding. And a lot of these shampoos, everything is more external. And unfortunately, because a lot of these types of hair loss are more internally driven, there's not a lot that's going to make a huge difference.
Okay, because I was going to ask you about the micro needling and the red light caps and all these kind of things. So you're not sitting there routinely thinking that it's supplemental to something else for them to be doing it.
Yeah. Well, I mean, so there is, I think, some data with some of these types of procedures and devices. I will sometimes do some things like platelet-rich plasma injections, PRP. I think that can be helpful in some cases for acute shedding, as well as women with female pattern thinning. I have seen that helpful. I would say in patients with really severe shedding or thinning, though, it would be probably in addition to doing like an oral medication as well. I wouldn't want patients to waste their time and money on something that may not be enough for them on its own. I would say the red light caps, I think we are getting a little bit more data. I think, again, in a role as an adjuvant to additional therapies, I think can be helpful. Or maybe for patients with more mild female pattern thinning, it can be used and helpful. The microneedling, there is a little bit of data. I think how it works is basically little micro traumas like on the scalp can help the body and just kind of stimulate a little bit some of the healing. And there's some properties with that to help with certain types of hair loss. But definitely there's just so much like hair vitamins. Biotin is a big one that comes up a lot where patients will be taking these mega doses of biotin. And unfortunately, there's really not a lot of data that biotin can help with hair shedding or hair thinning unless you're really like severely deficient, which most people are not. So, yeah, so just interesting to a lot of patients buy a lot of stuff. They're just desperate. They're just trying to find anything that may help a little bit. But Unfortunately, I would say some of that stuff may be a little bit not the best use of time and resources.
I'm definitely the person that wants to believe all the ads. And so there was a microneedling ad the other day, and I was like, maybe I was going to buy it, right? And then she says in the ad, within 3 weeks, she's throwing around all this luscious hair. She's like, within 3 weeks, it was thicker and fuller and longer. And I'm just thinking, okay, now you're lying. Like, we know within 3 weeks it can't change that much. So
I know
solve
it is too
me.
good to be true. Sometimes it is, unfortunately.
Are there tips, like maybe two, three tips that you maybe they got on a medication or not, but that you give to people when you're treating their hair loss, like maybe even from a nutritional standpoint or other things that matter as far as routines?
Yes, absolutely. So, kind of going to patients who are dealing with this on like a weight loss journey, I would say there's a little bit of evidence to suggest that more gradual weight loss can be helpful if possible. And I know this is maybe easier said than done, but trying to aim for more like 1 pound of weight loss per week. Or even a little bit less than that, just so it's a little bit more gradual process. Usually, patients who are able to not lose more than 2 pounds a week don't seem to get the same degree of severe hair shedding. It seems like that's the breaking point where the body just is comfortable with that type of weight loss and they don't become more stressed physiologically and have more shedding. I would say another thing, too, just in terms of the nutrition, is, and I'm sure you talk about a lot of this in your other podcasts as well, but protein is super important. So there's a lot of data on this, trying to aim for at least like 80 to 100 grams of protein, or even more, like up to around 1 gram per pound of body weight. This seems to be really helpful for supporting the hair and helping to avoid the shedding that can occur. And then I think I mentioned a little bit previously, but on the iron, vitamin D. So definitely encouraging patients to have iron-rich foods, red meats if you eat them, spinach, lentils, also taking with vitamin C. So I often recommend a supplement, which is like a combined iron, vitamin C. There's a few formulations like that, but that can really help with absorption as well.
Yeah, love that. Gosh, it makes such a difference in the labs that I see for patients when we put vitamin C with it. It's night and day as far as I'm concerned. Do you think there's anything that we didn't talk about in this category? I know there's always so much more, but that we didn't talk about that you think the listener should hear?
Yeah, I think a big one is if you're experiencing this type of hair shedding, it can be super scary. And there's a big emotional component with all this. I have had patients, even as dramatic as literally shaving their head because they were just so upset by how much hair was coming out. We've seen that, especially like after like COVID, hair shedding can be really dramatic. But I think the big thing is just not to panic. So this type of hair shedding is almost always completely temporary. And so the hairs that are coming out all will regrow. And so I think the big thing is just to not stress too much. I know easier said than done when you're going through this and having gone through it myself, but we have a lot of really great treatments now for this if you need it. And worst case scenario, the hair almost always will completely come back on its own. So the hair follicles are very healthy. There's several different types of hair loss I deal with, but the ones we talked about today, these are all completely non-scarring. They don't involve any damage. The hair follicles are still completely healthy, and so the hairs can completely grow back.
Oh, this is really encouraging. Thank you for offering that. I think people need to hear that. And I do like how you're like, get evaluated because I really, even when I'm seeing patients in clinic and I suspect it's XYZ, I still want a dermatologist to weigh in because it's just too important for us to get it wrong. Can you tell everybody how can they find you, your website? Let us know roughly what states you see and all of that, just so that people can get a little bit of a sense of that.
Yeah, absolutely. Yeah. So my practice name is Carabella Dermatology. And on my website, www.carabelladermatology.com, you can make appointments directly through there. You can do your own online scheduling on the website. I see patients in most major states in the United States, including Florida, Texas, California. I'm licensed in close to 20 states. I also see patients in person in Carmel, Indiana. I do a lot of hair loss consultations through there. Often patients can send photos over in addition to doing the video consultation so we can just see a little bit better what's going on. And also a great way to determine the type of hair loss is patients can even do what's called like a little hair pull test. You just gently tug on the hairs and we see how many hairs come out. And that can be a really good indicator if you are having an acute shedding event going on.
What would, just from the last thing you just said, so what's significant when you do that hair pull test?
Yeah. So when I see a patient in clinic and evaluate them for an acute shedding or hair thinning that's going on, we'll do something called a hair pull test. So what I'll do is just grab, it sounds a little weird, but basically we just tug gently on the hair and we see if more than like 1 to 2 hairs comes out. If you start to see more than 5 hairs coming out, that often is a red flag that there is an acute shedding event going on. And then also I'll look up close on a patient's scalp with something called dermoscopy. We look with a specialized magnification tool. And then looking at the hair follicles themselves, we can get a lot of information. Often patients who are just getting shedding or telogen effluvium, the hair follicles all look about the same size. However, when somebody is also having female pattern thinning or male pattern thinning, you'll actually see something called hair shaft variability. Some of the hairs are normal and thick, but you'll also see some of these really thin hairs or miniaturized hairs. And so that's a red flag that there's more of a hormonally driven hair loss going on as well.
Yeah, this is so fascinating. I know you did all this to me, and everybody, it doesn't hurt when she does the blow test, but it was so fascinating when you took a look and you're like, here's what I'm seeing with the pores and all that. It was just so fascinating. Thank you so much for coming on today. Everybody who's listening, we will have the link to her website and everything listed below right where you're listening. Or if you go to rentiaclinic.com and you click on podcast, we have all of this written up, all the information with links to everything. Just thank you again for taking the time.
No, thank you so much for having me.
That marks the end of today's episode. But if you're newer to the podcast, I want to tell you about something that we have, and it's a free podcast roadmap. So this is perfect for any of you that are listening where you want to be directed to very specific episodes. So let's say that you are just starting out and you want to know, what should I do right when I start on the medications? Or you're experiencing certain side effects on the GLP-1s, or you want to know what to do if you're in a plateau, or if emotional eating is taking over, or if hunger levels are high. So we have many different categories of episodes that we've talked about, because there's a lot at this point. So if you want to be able to navigate that very easily, we have it broken down by category and also the episodes that are there, and we hyperlink to everything. So you can just click on it and find the episode, easy peasy. If you want that, you can go to rentiaclinic.com/podcast roadmap. We'll have it linked right here underneath the show notes where you're listening. And you can go ahead and get that free resource so that it makes it easy for you to navigate, because I know that it's really hard when someone has an established podcast. I am such a podcast fiend, listening to podcasts all day long. And when I find one that I love, but there's a lot that are out there, I am so lost. So I hope that you enjoy this free podcast roadmap. Again, the link to get to that is going to be rentiaclinic.com/podcast roadmap. I hope this is helpful, and let me know if you have any questions.